Diseases doctors often miss, episode 2. Polycystic ovarian syndrome, or PCOS, is a hormonal condition that affects over 5 million women of reproductive age. Women with PCOS produce higher than normal amounts of male hormones, and as a result face issues with fertility, appearance, and even have cardiovascular consequences. For a diagnosis, patients need 2 of the 3 Rotterdam criteria, which includes infrequent or missed periods, increases in male hormones, or polycystic ovaries on ultrasound. Too often it's overlooked or misdiagnosed by doctors simply because they're focusing on the symptoms rather than the root of the problem. In fact, if left untreated, PCOS can negatively affect mood, blood pressure, blood sugar, cholesterol, and even lead to metabolic syndrome. While there is no definitive cure, there are medications that can help normalize hormones as well as increase the chances of pregnancy if desired. Subscribe for episode number 3.